affected, you call it tendinopathy or tendonitis. Muscle, you will get the strain or tear, and ligaments, of course, the sprained ankle, or you will find the fracture of the bones. And treatment always varies, depends on the which tissue has been affected. And these are the total bones. You know the tarsal bones, metatarsophalangeal joint, Lisfranc joint, other metatarsophalangeal joint, tarsometatarsal joint. These are the all bones that you should have to know. So, ankle, how you can diagnose? To diagnose an ankle disorder, you will evaluate, yours must evaluate the symptom, you must examine the ankle and ask about the recent injuries. Now, when you see the bone fractures or tendon tears, you must have X-ray and MRI and computer tomography, that is CT scan. These are the three important important testing that you should have to go for that when you will find the ankle injury. And we should have to know the 5 most common foot and ankle injuries. Achilles tendonitis or tear. The tendon runs lengthwise down the back of the ankle and is particularly susceptible to inflammation because of overuse. This condition is called Achilles tendonitis and can be addressed with tendonitis ankle treatment. And ankle sprain. When a sprain occurs, one or more ligaments have been stressed or torn. High ankle sprains, among the most common foot and ankle injuries, impact the syndesmotic ligament, which run from the knee down to the ankle. And number 3, stress fracture of the foot. The impact of excessive and repetitive forces can cause microscopic damage to the bones in the foot. These stress fractures most often are seen in second and third metatarsal, base of the fifth metatarsal, navicular and sesamoid of the big toe, and plantar fasciitis. These are the related injuries you will find during the ankle injuries and fracture of the ankles. Whether an ankle fracture is one or more multiple bones, whether it occurs with pain, swelling, bruising, deformity, blistering, or other symptoms, it is a serious injury that requires care from an orthopedic ankle specialist. If there is a bone protruding from the skin, the injury must be addressed immediately to reduce the risk of infection. An ankle fracture is a much different injury than an ankle sprain, although it is not uncommon for them to occur simultaneously. But sometimes patients confuse these two and wrongly self-diagnose. Now, regarding the ankle sprain, we should have to remember the 3 grades. When you are thinking about the grade 1, you will feel sore and maybe slightly swollen. In this case, the ligament has been overstressed but not torn. Grade 2, partial tear in the ligament, and this causes prolonged pain and swelling. So this is different from grade 1 to grade 2. And whenever you will talk about the grade 3, full tear of the ankle ligament, this is accountable for grade 3. Then when you see the ankle injury, how we can proceed? These are the things. These are very common things. Rest, R-I-C-E, rise. That means rest. It is important to raise the ankle to prevent further damage and deep wave of it. Ice, using ice will help slow or reduce the swelling and provide a numbing sensation that will ease the pain. And of course, the compression, wrapping the injured ankle with an elastic bandage or off-the-shelf compression wrap will help keep it immobilized and supported. And you should have to elevate your limb. Elevating the injured ankle to at least the level of your heart will reduce swelling and the pain. So these are the important things that you should have to keep it in your mind. It is important not to put any weight on the ankle until after it's been evaluated by a doctor, which should be done as soon as possible. Fractures and sprains that are ignored or are not treated properly can lead to long-term chronic problems. Sometimes we are getting this kind of patients, chronic problems with ankle, such as repeated injury, ankle weakness, and arthritis. So, tips to protect your ankles. What you should have to do: avoid exercising or playing sports when tired or in pain. Do ankle stresses before playing sports or exercises. That is usual to warm up your ankle. And watch a step means when you walk on cracked what side or uneven surfaces, you should have to watch your steps and run on flat surfaces to minimize the chance that will twist and injure ankle. And you should have to wear the sensible shoes. You should have to choose your footwear that fits well and is suited to what you are doing. And this is the ditch the toes. That means wearing high heels is one of the biggest cause of ankle sprains among the women's. You will see in European countries, and especially they are wearing the high heels, and that will cause a problem. Now, dear friends, regarding the ankle injuries, I would like to share some cases. See, this is lacerated high trauma injury of both foot and ankle of a 6 years old girl. Look at this. So, devastating injury. And then what I have done, very simple. Since considering the age of the patient, 6 years, put one ring here and only two olivers from the medial side, from the lateral side, and this is the arch. And see here, the treatment is very nicely, you can apply the one ring and half ring with hinges, and then see after 5 months follow-up, the totally healed and no problems here. There was a soft tissue injury and a little bit bone injury and then ankle injury. So it was treated by simple way with Ilizarov technique. Now, open fracture dislocation, you can see here, this is also related with the ankle. Look at this, school teacher. This is the open fracture. Look at the dislocation, look at the ankle, and then what I have done, tibial block 2, and then half ring with hinges, smiling lady, and see the dressing, you must properly dressed, and the bending of the wires, and this is the half ring, this is the hinge, and 2 rings blocks distally. So this is only after 3 months, reduction was done, and you see, you will not see any kinds of problems. Patient is happy and reduced and well reduced and without any complaint. Now, this is the symbol I can relate it with the ankle. Just I'm showing a simple case of 17 years old girl. You can see here bimalleolar fracture with talar shift laterally. If you draw axis line, the shifted laterally, then this kind of, in other ways, you can go for the plating and screws, but see, by putting the one block here and post, 3-hole post here with one olive to connect the syndesmosis, and you can reduce the medial malleolus as well as the lateral one. See how I have reduced with a half ring here. Now look at the patient. She was a standing condition with the apparatus, and this is the X-ray findings. Look at the first ring and the post and half ring in the calcaneum, and this is the X-ray view. Now you can see just after before treatment, the medial malleolus was like that, and this is the lateral malleolus, and after correction by Ilizarov technique. So these are the fractures of the ankle. You can nicely reduce, and you can reduce, and you can put the Ilizarov, and you can have a very good result, outcome, and long-term follow-up. Look at this. This is also related to the ankle. This is a case of, you see, intraarticular with bimalleolar fracture, and this is a shattered bone lower one third. Again, you can see here, this is the three views of the x-rays, and then what we have reduced it with Ilizarov apparatus and fixed it with the olive wires from the medial side and from the lateral side, and two rings in the, one in the proximal, one in the lower one third, and we have reduced, and you can see the axis is almost the normal. There is no displacement, no problems. And why I have put the first ring here, you can put it here, because it gives more stability from here to here. The total bone is lower one third of the tibia. It is almost related with, this is a pylon fracture intraarticular with bimalleolar fracture. And you can see here the before surgery. Look at this, the displacement and the combination, and then this is after reduction, this is after treatment, and this is the external view of the leg you can see here. So dear friends, now you can see this is also related with the ankle joint, because the open one, ankle with some cases with the open Lisfranc joint and dislocation of a 55 years old man. Look at this. This is related. When it is open, the infection may go to the ankle joint. There is a combination, and at the same time communication of the ankle with the tarso-metatarsal joint. These are the open fractures. You can easily reduce, and you can reduce the bones by pulling the bones with olive wires. And see, this is the during the dressing process, and you can see there's a good granulation tissue here, and these are the rubber stoppers. Just when we are doing this dressing, then we have taken this picture, and after doing the dressing, you see the rubber stopper with beautiful gauze. You should be able to cover so that you cannot invite the infection. So from this situation, from that situation, the bone almost in the normal position. This is the final outcome after 3 months of treatment. Now, dear friends, again you see here, neglected intractable sole and dorsal of the foot of a 42 years old male. See, look at this skin condition. These are also the challenging cases. Look at the sole of the foot, dorsal of the foot, and then what I have done, look, I have done the TTT, tibial transverse technique here to control the infection. When you will do the TTT, these are the traction clips, 1, 2, 3, 4, and then this is the fracture here, open case, and then you go for the distraction, and then you can see here the olives, this is the osteotomy side, and then see after 5 months follow-up, the skin condition is almost, the color of the skin change, and this is after 5 months follow-up. And this is the, after 12 months follow-up, you can see from these situations, very bad, from this situation. This is only, it can occur with the help of Ilizarov technique. When you are giving this kind of Ilizarov application, by doing the TTT, you can invite neovascularization, which will totally change your color of the skin. And this is the dorsum you can see here, and this is the back of the skin. Look at this. So back of the sole, and this is the final I've shown you. So another you can see that is related with the ankle and dorsum of the foot. The bones are open. This is gastilo 3B related with the total ankle injury and foot. Individual ankle sometimes you'll get a load, but this will combine with the soft tissue as well as the tarsal and metatarsal bones. Now this is the dorsum of this is the plantar surface, the dorsum of the foot, and you see the sole of the foot, how the bad condition of the skin. This is the normal one. It looks like a diabetic foot, but patient is non-diabetic. And look at this here, dear friends. It was treated elsewhere by putting the only K words here. Then what I have done, look at this. Again, 2 block here in the proximal, that means distal tibia. And then you can see here the putting the tarsal bones. This is the ankle, the construction of the ankle frame, and the olive wires you can see, and this is the sole of the foot, and we have put the multiple covers through the toes, and this is the, after treating you can see the sole of the foot. And then look at this, after 6 months follow-up, from this situation, ankle and foot, from the back view, and this is the after removal of the apparatus. A little bit problem was in the grade 2 and first metatarsal, but that was healed very nicely. Now look at this after treatment. You can see only after 6 months from this situation to that situation. So these are the things that you can change the all kinds of difficult problems by applying the Ilizarov apparatus. So now sometimes you'll see a lot of talar bone fracture. Look at this talus. This is the fracture of the talus. See, at the age of 65 years. So these are also the difficult problems, how to treat all these kinds. Now what I have done, you can see, the operations that I have done here. Again, the one ring here, one ring, distal tibia 1 block, these 2. And what I have done, I have reduced the fracture, and then see, look at this, before treatment, the body of the talus and neck of the talus, you can see in after 3 months treatment, it was possible only with the biocompatible thin words. So this is the treatment of the talus fracture. Look at this again, calcaneum. Here, open fracture of the calcaneum. You cannot go for any kind of plating and screws fixation by this kind of open injuries. Look at the calcaneum, the position of the calcaneum. Look at the length and width of the calcaneum. Now, whenever Ilizarov in your hand and you see the subtalar joint, no space, bowler angle is almost reduced, and then you can go for a distraction by putting the wires. Look at the lateral view. What I have done, one ring here with hinges, and then in the calcaneum, after Shyam, under the Shyam control, you could reduce the fragments of the calcaneum. And what I have done here, one ring here in the talus and in the forefoot, half ring, then I have reduced gradually. And what I have done, now you see the calcaneum of these, and this is the length and width. You can see only the fruitful results after 3 months of treatment with Ilizarov apparatus. So, dear friends, these are the cases that I have shown you so that you can realize how we can treat the ankle injuries, sometimes ankle related with the midfoot, forefoot, or hindfoot. So this is Professor Ilizarov, who more than 10 times came to my country. Professor Shamsul, who came to Bangladesh for more than 10 times. And you see the picture is 2009, left side, and now 2022. So time has passed. How many years? 13 years. And this is you see the Novikov, Burjunov, Plushin, all big guys during our conference in my country, 2019, in Orthopaedic Center, Bari, Ilizarov, with Legends of Kurgan, Russia. So these are the things that, I always show this slide. Why? Because what I have shown you, that is the evidence that I have shown you, that is evidence. And based on everything on science, and of course the surgical skill of the surgeon. And whenever you follow the principle and philosophy of the Ilizarov, you can have very good result, and outcome is always fantastic. And by Ilizarov technique, you can solve a lot of problems in human body, starting from trauma to any kind of deformity in human body. 85 to 90% of the problems you can solve. So these are the a little bit. I tried my best to show you the ankle injuries. Thank you so much for your kind attention, dear friends.
Thank you very much, sir, for your excellent presentation. That was a unique presentation. Now, I would like to request our honorable academic expert to share their knowledge. First, I would like to request Professor Omer Barawi, sir, to share his knowledge regarding the presentation. Professor Omer, sir, would you please?
Okay, thank you so much for a nice presentation. I have two questions really. One of them, is there any role of skin graft in your cases? This is one. And the second thing, are you going to do gradual or acute reduction of such cases by ligamento-taxis?
Yes, two questions are very good. In most of the cases, I don't need to go for any kind of skin grafting. If your space is big, then you can go for skin grafting. And the second question is, whenever I have done it acutely or I have done it gradually, you can go for, depends on your case, you can go for acutely. As for example, in case of ankle fracture dislocation, fresh case, you can do it acutely. If neglected case, then you can go for ligamentotaxis. Gradually, you can correct the the problem, dislocation and fracture. Gradually, you could do that. And in Ilizarov principle, what Ilizarov said, everything must be done gradually. This is the principle of Ilizarov. You can go for gradually. And this apparatus always gives you the ligamentotaxis. That means you can distract gradually without hampering any kind of soft tissue or any vessels. So this is the beauty of Ilizarov. Thank you.
Thank you so much.
Thank you very much, sir. Now, I would like to request Dr. Shamsul Huda, sir, to share his knowledge. Dr. Shamsul Huda, sir, please.
Thank you, sir, for a wonderful presentation. We learned a lot from these presentations. In ankle, I'm doing regular Ilizarov in my cases, especially when the cases are compounding carbonated. The close fracture we're doing with plate or nail S2, but when there is a compounding, or if you want to do a primary Ilizarov in this cases, it gives an excellent results because plates and screws just give compression, they don't give distraction. With Ilizarov, it's always possible. So when fixing the ankle fracture with Ilizarov, we have to take care of a few things like if there is compounding or not, combination is not. We have to see the adjacent bones, the ligaments, soft tissue and vascular status is very important. For reduction, we have to take care of the mortise, articular surface, congruity, the tibial joint, the talocartilage joint. We can span with the foot ring also. We have to see for the clearer space. We can reduce the malleoli with olive wires, and for the oblique fractures, we can do with olive and counter olive wires. We can always do the soft tissue procedures, as Bari sir said, we can do a flap or skin graft as needed. With the hinges, post-op, we have to always mobilize. We have to always mobilize. We have to take care of the range of motion so that the joint doesn't become stiff. So early rehab, range of motion, activities of daily life must be promoted always. Normally, we remove the rings in 3 to 4 months. So I have two questions from Bari sir. Number one, sir, in the grossly displaced fractures, when we cannot do reduction with olives, do you open the fractures of ankle, especially talus? What reduction techniques you use in this that, sir? And number two, sir, what is your post-op and post-removal protocol, sir?
Good question. Number one, when you cannot reduce by olive or by close method, then you need to go for sometimes a minimally invasive. In Ilizarov surgery, the beauty is that you can reduce a partial, and if you think that it needs open reduction, minimally invasive incision, you can go for open reduction. And there is no, complication because you are playing with the wires. And these wires, when you are making a small incision, and this a small incision cannot hamper the healing process of that region. This is number one. And the number two questions you asked regarding the what? Plated screws.
Regarding the post-op and post-removal protocol, sir.
Post-op protocol. Ilizarov surgery post-op protocol is very important. Stable fixation is mandatory for Ilizarov apparatus, and you must check every day. Ilizarov surgeon must have patience. Check the proper way, whether your frame is stable, wires are stable, tighten or not. You must check every day, all time. And for dressing, you can go for 7 to 10 days. And you must cover the Ilizarov wire pins that you have put through the bones. You must cover it nicely with gauze. And you should have to wash it with all the time with saline water, or you can use the normal water. That means normal water means pure water or distilled water. You don't need to go for any kind of hexi scrub, hexisol, or iodine type of solution. So these are the things that you should have to keep it in your mind. Strictly follow the post-operative protocol, doing the dressing, and do the exercises, physical therapy for the patients, movements of the ankle joint, movements of the knee joint, and toes of the, always you should have to support it by physiotherapist all the time. And tell your patient to cover the whole thing so that you cannot get any kind of dust from the outside. You must cover the whole frame by making your cover, and that it looks nice. When I see in my country, a lot of the young doctors, even then yesterday I got one case, all wires are visible. It looks ugly. You must cover all the wires nicely, and you must see the tension of the wires is regularly, because whenever your proper tension of the wire is not there, patient will tell you, doctor, I'm feeling pain. And you cannot get a very good regenerated bone without the proper tensioning of the wires. These are the few important things. Basic Ilizarov, we should have to know that one. Thank you.
Thank you, sir. Thanks a lot, sir.
Thank you very much, sir. Sir, I have one question. That is, sometimes we found AVN in case of talus. Is there any role of Ilizarov in case of AVN of talus?
Yes, see, there is a Baylor operation. When AVN, you should have to go for talectomy sometimes and go for arthrodesis of the subtalar joint or full ankle joint, triple arthrodesis. Sometimes it creates a problem, and AVN of the talar bone creates a problem, and sometimes you need to go for the arthrodesis of the subtalar joint or the pen arthrodesis of the whole ankle joint. So only AVN and comminuted fracture of the talus, it creates a problem. You should have to go for the operation of the full ankle joint. So getting AVN, you cannot have very good outcome. Even then with Ilizarov, you should have to go for arthrodesis of the pentalar or subtalar or full ankle joint.
Thank you very much, sir. Yes, sir. Thank you. Thank you very much, sir. I think it was a great discussion, and we have learned lots of things from your presentation. And I would like to say thanks to Raj TV and Orthopaedic Solution Academy, as well as the Malia CNT Specialized Hospital, for helping us to arrange this type of program. I hope we will connect you in the coming Friday with another magical topic of Ilizarov. Until then, I would like to say bye-bye to all of you. I would like to thank to our honorable speaker and honorable academic experts for joining with us. Bye-bye to all of you.
Okay,
Thank you.
baby. Thanks so much.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
তানভীর নেক্সট ফ্রাইডেতে তো আমি ফ্লাই করব, সন্ধ্যার সময় চলে
Yes,
যাব।
sir.
নেক্সট ফ্রাইডে কি ঈদের আগের দিন কি চলবে?
ঈদের আগে স্যার আমরা একটু
Can we have
we did
foot
this
after ankle, sir? All the foot injuries after ankle.
all
Foot, sir.
yes,
All the foot injury.
Talus, calcaneum,
Talus, calcaneum.
Lisfranc.
This friend,
All of Ilizarov
yes.
and foot injuries, sir.
Foot injuries.
Yes, sir.
Foot series of foot, sir.
Yes, you can do that. Even a small bone fracture, there is also very good role of Ilizarov, tarsal bone fracture only. It can be one topic. Disfranc joint, tarsometastarsal, one topic. Fracture of the phalanges, one topic. And deformity of the foot. Lot of things are here.
Yes, sir.
Lot of
Yes, sir.
things.
One lecture on
Yes, sir.
talus, one lecture on calcaneum,
Calcaneum, only one lecture. You can go for calcaneum fracture.
and talus also, sir. Single lecture.
Talar also fracture. Yes, you can do that.
Yes.
Talar fracture. Or continue sequentially 3 or 4. Next Friday and Sunday, Idul Adha. So
Right,
that's
sir.
why Friday you are going to do a stop it. And I'm going to Sydney on